Hey, this is Rebecca Hart here at Faith, Hope, and Wellness, and today we're going to be talking about Bartonella. Bartonella is a co-infection of Lyme vector-borne disease spread by ticks. Bartonella, though, has several different vectors, meaning things that carry Bartonella. So Bartonella is known for cat scratch fever. Cat scratch fever carried by tick bites, but it's also carried by cat bites and by cat scratches. And actually, there's some literature saying that dog bites carry it as well, but not as mostly as cat bites. Also, you have lice and you have fleas that carry Bartonella. So multiple vectors. So can you have Bartonella without having Lyme? Sure, you can. So let's talk about some of the symptoms. One is unusual neurological symptoms. So such as you're having internal vibrations or paresthesias, which are tingling, numbness, burning sensations. Next one is more psych related. So these patients have a lot of psych issues, and we're speaking about chronic Bartonella here. So anxiety, panic attacks, irritability. These patients have a lot of anxiety and they can have some paranoia as well. They can have visual disturbances. So patients have described, like, I look at my phone and I'm looking through a fog glass. Some people see more floaters. A hallmark characteristic skin wise for Bartonella is tracts or striae. So these patients have what look like stretch marks, but they're huge stretch marks. So they will come and they will go away as quickly as they came. And they blanch. So the difference between regular stretch marks and Bartonella striae is the Bartonella striae, when you press them, they will turn white and then turn back red. They have deep bone pain. So you'll have patients complain of deep bone pain, mostly in the small joints, so fingers, toes, feet. They have a lot of sole of the foot pain. So you'll find these people, I've been diagnosed with plantar fasciitis. Classic acute would be lymph nodes. So in chronic, they have lymph nodes as well. So lymph nodes pop up, neck, underarms, or groin. I've had a couple of people now that just horrible abdominal pain. They've been checked by GI. They've been checked, cultures, endoscopies, colonoscopies, the whole GI workup, and CTs of the abdomen and pelvis, and nothing can come up with abdominal pain. Seizures, they can have seizures. Also livedo reticularis. So what is this? This is basically modeling of the skin. So I've seen it on people's knees. I've seen it on their thighs, under, their triceps and their arms. And so these are just some of the symptoms that somebody may have with chronic Bartonella. And some of these can be quite scary. Testing is very hard for Bartonella. Bartonella is very hard to capture. It only shows up on testing about 30% of the time. You can do PCR testing. PCR measures more DNA of Bartonella in the blood. You have Bartonella Hensley, Bartonella quintana, and some other Bartonellas as well. So there's different species. So you can look for those PCRs for particular species of Bartonella. You can have IgM and IgG. IgM means now infection, IgG means past infection. Immunoglobulins are hard to capture because of the fact that a lot of people that I test are chronically ill, and so they have a weakened immune system. So you're asking the immune system to recognize a chronic infection. So it's very, very difficult. Also, the Bartonella, you can do, the last one would be a FISH test. And the FISH test is more of fluorescent in situ hybridization, which means that it's pretty much 100%. They can see the Bartonella fluoresce on a blood screen. So that's usually the preferred method that I choose, but you can use all three of these as well. Now, what we're going to be doing over the next couple of weeks is rechecking and talking about different co-infections of Lyme. And so we'll talk about symptoms of each one and kind of some testing and things like that. So look forward to seeing you next week when we talk about a different co-infection. Have a good week.